So let us start with another high-yield question related to medical ethics. So this is a 60 years old male who is presenting to the emergency department with complaints of shortness of breath, and he has a history of diabetes, mellitus, hypertension, and coronary artery disease. His EKG showed PT waves, which is suggestive for hyperkalemia, and the labs also confirmed that he is in acute renal failure with a potassium of 7. While reviewing his chart, you find that he has filled DNR and DNI, which is do not resuscitate and do not intubate orders, respectively. And he confirms that he still feels the same way and he would like to both the DNR and DNI forms to be kept on the front of his chart. It means that he is persistent on his decision. Which of the following is the most appropriate at this point? Option A, ask the patient if he has an advance directive or living will. Option B, inform the patient that he will likely die without overturning one, and if not both of those forms. Option C, ask the patient if he has a durable power of attorney or surrogate decision maker that he would like you to consult. And option D, dialyze the patient anyway and admit him to the ICU, but do not intubate him if it becomes necessary. Option E, treat the patient with medication only and admit him to a medical floor bed. So at this moment, take a pause and think of the likely answer. So option D, that is dialyze the patient and admit him to the ICU, but do not intubate him if it becomes necessary, is the right answer. So this patient who is in acute kidney injury or acute renal failure with a hyperkalemia, potassium is 7. So hyperkalemia is a well-known and life-threatening condition which can cause fatal arrhythmias in the patients who are having chronic or acute kidney injury. And this patient, he has labeled himself as DNR and DNI, that he does not want to be intubated and he doesn't want to be resuscitated in case of any life-threatening condition. So this is the will of the patient. This is the decision of the patient, and you have to follow that decision made by the patient. But it doesn't mean that you don't have to treat the hyperkalemia, you don't have to treat the acute renal failure. DNR or DNI doesn't mean that end of the life care. So you can say that DNR and DNI doesn't equal to end of life care. So you have to treat the patient, you have to provide all the necessary and appropriate treatment modalities, all the diagnostic workup. But if the patient becomes uh, unconscious, or if the patient needs intubation, or if the patient needs the resuscitative measures, so you don't have to perform the DNR, or you don't have to intubate, you don't have to resuscitate the patient, and you do not have to intubate the patient. But rest of the treatment, you have to uh, perform all the appropriate and required treatment. So in this case, the patient is having acute renal failure and he is having potassium of 7, which is severe hyperkalemia. So you have to dialyze the patient and you have to treat the hyperkalemia. So you should admit the patient to the ICU and you should dialyze the patient. And you're not going to intubate the patient if it becomes necessary, as the patient is forbidding to intubate and to be resuscitated. So, and option A, ask the patient if he has an advance directive or living will. So this is not necessary, or this is not the appropriate at this time. At this time, patient needs to be treated against the life-threatening cardiac complications such as arrhythmias, and the patient needs to be dialyzed. And it is not the appropriate time to ask this question. Once the patient is stable, then you can ask this question later on. And inform the patient he will likely die without overturning one. It is again the wrong answer, because you have to treat the patient without overturning the DNI or DNR forms. because you have to treat the patient even the patient is labeled as DNR or DNI. And again, option C is just similar to option A, and you can ask the patient about a durable power of attorney or surrogate decision maker. But first, you have to treat the patient. First, you have to dialyze the patient, and then you can ask the patient about this. So, option E: treat the patient with medication only and admit him to medical floor bed. So, DNI, as I mentioned earlier, DNI or DNR doesn't mean that you don't have that you have to limit the treatment options. So it doesn't mean that you have to end the life of end the life care facilities. So you have to provide the patient with all the necessary and required treatment options, and you're not going to treat the patient on the medical floor, and you're not going to treat the patient with medications only. So this is the wrong answer.